Welcome, everyone. We're just going to wait for a couple of more minutes while more people are connecting. So we'll be back in a second. So good morning, good afternoon, or good evening, and a very warm welcome to everyone who's joining us today for our event, the Global Fund and Unitaid Partnership on Accelerating Access to Innovation. My name is Miriam Große-Guschkamp, Senior Advisor to the Executive Director at Unitaid, and I'm very pleased to be leading you through this event today. With this event, we very much want to showcase the importance of multi-partner collaboration. And so in our event today, we will really look at how the Global Fund and Unitaid are building on their longstanding partnership and complementarity, and how they, together with many other partners, are really accelerating and making sure that life-saving and fit-for-purpose and affordable health innovations reach affected communities faster. We are particularly pleased to be joined today by so many key global health actors and high-caliber speakers who you will hear from later today. And before we take a look at the agenda, let me just remind you that this meeting will be recorded, and that please feel free to use the chat at any time for questions or comments. We might not be able to answer them today, but we will definitely get back to you later once we can. And looking at today's agenda, we will start with the leadership of the boards of Unitaid and the Global Fund for opening remarks. We will then hear from Peter and Philippe from donors and communities. We will look at the impact of the partnership and at a few examples of successful collaborations that we've had in the past. We will look at our joint priorities going forward, and finally end this with a short panel discussion and some closing remarks from another donor's perspective. And now, without much further ado, let me welcome Marisol Turenne, the chair of the Executive Board of Unitaid, and Lady Ross Morata, the vice chair of the Global Fund, to open up this meeting. Marisol, the floor is yours.
Thank you very much, Miriam, and Dear Lady Rose, dear Philippe, dear Peter, good morning or good afternoon to all of you. I'm very happy to be here with you to open this Unitaid-Global Fund event on accelerating access to innovation. And I am indeed very pleased to see that it has generated a lot of interest. I would like, of course, to welcome you all, board members from both organizations, representatives from civil society, from countries, and from our technical partners. I want also to thank the two secretariats for the preparation of this event, and of course, thank more specifically Philippe and Peter, Philippe Dunton and Peter Sands for this organization, but also I want to praise their leadership, as well as their continuous efforts in securing our organization close. From my point of view, this event takes place at the right moment for at least three reasons. First, we are at a moment we need to accelerate our efforts. The clock is ticking, and we need to move fast if we want to reach the SDGs targets. Let's be realistic, both realistic and voluntary, of course, but let's be realistic. Over the past few years, progress towards achieving SDGs 3 has gone severely off track. Reaching many of the targets will now be very hard without collective and extraordinary effort. We need new products, better medicines, smarter approaches, and new technologies if we want to be successful in reducing the spread of HIV, TB, malaria, and of course other diseases. Unitaid is committed to bring at least 30 of them by 2030, but we have to gather our efforts to get to that point. The second reason why I think it's important to have this discussion this afternoon is that we need to show better how we work together, the Global Fund and Unitaid. We are passing through a time of doubts and questions about global health architecture. And so we need to explain how complementary the Global Fund and Unitaid are. Of course, Unitaid is a small organization in comparison with the Global Fund, but we need to work together with other partners to address the many and often complex barriers that prevent equitable access to innovation. Unitaid leads the way in identifying game-changing health innovations and approaches to achieve access, and the Global Fund ensures that these products to be scaled up rapidly and reach the communities and people who need them. After more than 15 years of cooperation, our organizations know we can trust the efficient partnership we have set up between our two institutions. But we need to explain it better to our partners, to public opinion, to governments, to donors. And I would summarize the strengths of our partnership as follows, as I often say. Together, we save lives, we save time, and we save money. We save lives since 100 million of lives are impacted every year by our work. We save time because thanks to our combined action, reaching global health targets is shortened by more than 3 years. And we save money. Unitaid's work, for instance, on innovation will save $5 to $6 billion by 2030. Last but not least, and that's the third reason why I'm happy with this event this afternoon, we need more than ever to ensure health innovation will reach the people who need them most, notably in low and middle income countries. Unitaid Next strategy calls for stronger engagement with countries and within countries with affected people and communities to ensure that they are part of every step of our work. This approach also is part of our collaboration with the Global Fund. Dear colleagues, without a completely replenished global fund, Unitaid's intervention will not reach their impact. But without a fully funded Unitaid, the global fund will not have the innovations necessary to reach global targets. Our partnership is a promise of impact, and that's what we expect to show you this afternoon. I really hope that you will enjoy the presentations, and I wish you fruitful discussions. Thank you. Back to you, Miriam.
Thank you very much, Marisol, for this very inspiring message. Let's hear from Lady Ross.
Thank you very much, Miriam, and thank you, Marisol and Philippe. Partnership and innovation are in the DNA of the Global Fund. It's a pleasure to join with Unitaid for this event and to see so many of our partners here today. 20 years ago, the world innovated in its fight against the three deadliest diseases, HIV, tuberculosis, and malaria, by creating the Global Fund Partnership. Since then, the coverage of treatment and prevention interventions for HIV, TB, and malaria in countries where the Global Fund invests has increased rapidly. In those 20 years, health programs supported by the Global Fund Partnership have saved 50 million lives. But as we all know, COVID set us back. So to end the three diseases by 2030, we must redouble efforts. Faced with intensifying emergencies, from climate change to hunger to war and the specter of stagflation, we have seen increased disruptions to global supply chains, political and economic uncertainty, and rising costs of goods and services. Innovation and partnerships are more important than ever. And as we saw during the COVID crisis, emergencies can also spur innovation and strengthen partnerships. The challenge we face as a partnership is to accelerate the pace of innovation so that we achieve maximum impact. I'm very proud of the partnership between the Global Fund and Unitaid, a partnership that is key to defeating HIV, TB, and malaria, strengthening health systems, and supporting countries in their preparations for the next pandemic. A partnership that is delivering results through collaboration, as we will discuss today. A practical example of this partnership and innovation is the NewNets project, started in 2018, co-funded by Unitaid and the Global Fund, with complementary funding from the Gates Foundation and USAID, and led by the Innovative Vector Control Consortium. The project is accelerating the scale-up of next-generation dual-active ingredient insecticide treat nets by providing clear evidence of their impact on malaria burden through pilots in several African countries. 4 years later, new nets are now being rolled out in other low and middle income countries, including in my adopted country, Papua New Guinea, next year, with the prospect of saving many more lives. Drawing on lessons of projects such as this, we must continue to accelerate the pace of innovation so that countries don't need to wait for years for innovative, life-saving products to reach them. The Global Fund's new strategy, approved by the board last year, includes a greater focus on faster deployment and more equitable access to innovations. By working with partners to take an end-to-end view, our challenge is to rapidly address bottleneck or deployment to those most in need. Our partnership with Unitaid and you all is vital to our work on this. We must work together to maximize the impact of our work, leveraging each other's strengths and comparative advantages. We must harness the power of partnerships to accelerate the pace of innovation. And that's the focus of today's event. We have some terrific speakers, case studies, and success stories.
Lady Ross, you're on mute, unfortunately, for the last sentence. I think you muted yourself. Can you just unmute yourself and repeat maybe the last.
Oh, sorry, Mary.
Mute it again.
It's doing it on its own.
unmuted.
It's doing it on its
Now-
own. I'm not touching it. It's some kind of problem in my laptop. I don't know where it went on mute.
Maybe you
What
just
was the
repeat the last two sentences.
Oh, okay. That's not so bad then. Just the importance of our partnership with Unitaid and all of you to maximize the impact of our work. We must harness the power of partnerships to accelerate the pace of innovation, and that's the focus of today's event. We have some terrific speakers, case studies, and success stories. A lot to discuss, not just technical innovations, but also process and partnership innovations to achieve more, better, and faster. I look forward to that discussion, and thank you very much again.
Thank you, Lady Ross, for this very clear message. And with these important messages, we now move on to the executive leadership of Unitaid and the Global Fund to hear about the vision for this collaboration. It's my pleasure to pass the floor to Peter Sands.
Right. My video is being blocked by the controller here, the host. But can you hear me?
We can hear you.
Lisa, mine was also blocked.
But not to worry. Let me go ahead. Look, Marisol and Lady Roz, I think, have here my video. You get the pleasure of seeing me. Right. Marisol and Lady Roz have already laid out both the nature and the case for the partnership between Unitaid and the Global Fund. And if I can offer a personal perspective, I would say that this was obviously an important partnership when I first came into the Global Fund 4 years ago, but now it is more close, more intense. There's really good working relationships. I have huge respect for Philippe and the team. And I see it as very critical for our future together. But let me just give a little bit of context as to why I think this partnership is so important. The first one comes down to the absolute imperative to get more impact for every dollar. The Global Fund replenishment was in many ways a remarkable success. We had an unprecedented number of donors stepping up by 30% or more. We had visible leadership at a level we've never had before from many G7 leaders. But from a financial perspective, we're in a pretty challenging position. We didn't get the $18 billion that we needed. The replenishment itself isn't over because some donors, some key donors, weren't able to pledge in New York. And if anything, the 18 billion, which we didn't get to, is not nearly enough. We're in a world where COVID-19 isn't over. It's still causing death and destruction, both directly, but also continuing to have an impact on health services more broadly. Conflict is erupting in many parts of the world. Ukraine, obviously, Yemen, Tigray, too many parts of the world. And we're being reminded again and again that, as history has shown us, wars, strife, conflict typically kill more people through infectious disease than bullets and bombs. And then the other thing we're really beginning to see at unprecedented scale is the impact of climate change on infectious disease. The most obvious example right now being Pakistan. Thousands will have tragically drowned as a result of the floods in Pakistan. But we face the prospect that if we don't act decisively, tens of thousands could die of the infectious disease consequences. And I don't think we should see Pakistan as unique. We've already seen an increasing frequency of cyclones and tropical storms in many parts of the world. So what all this adds up to is this imperative to make every dollar have as much impact as possible. And we can only do that through innovation and through getting innovations through to the people who need them most. And that'll bring me to my second point, which is that doesn't happen automatically. If there's one thing we have learned through all the infectious diseases, including COVID, is that if you want equitable access, if you want new innovations to move rapidly through to those in greatest needs, you have to work pretty hard, because the natural outcome is that innovations go to those who have money and resources. So we have to work collectively to really drive equitable access, removing the host of barriers that can get in the way of that happening. And it is a we task. There is no single agency that can do this. The Global Fund can provide scale and the reach into many low and middle income countries. Unitaid has the relationships and know-how of working with manufacturers and helping bring products to market and shape the pricing. But we also need others, such as WHO, with the regulatory approvals and guidelines. This is all about shaping an ecosystem that draws innovations through to those who most need them as fast as we can. And I do want to come back to the point about speed and time that both Marisol and Lady Roz referred to. My background, as many of you know, was in the financial markets as a banker and economist. And in the world of finance, people always talk about time being money. And the basic logic is whenever you can do something, if you can do it faster, you can make more money. Well, in our world, there's a similar, analogous, and if anything, even more compelling argument, which is that time equals lives. If we have innovations available that are better, have less side effects, that reduce mortality, that reduce the risk of infection, and we take too long to get them to the key populations, the marginalized populations, the people who most need them, then that delay costs lives. And by correcting that, by reversing that and making things happen faster, we can save lives. And our record as a global health community is mixed at best. I mean, when you think about it, antiretrovirals took several years from being widely available in the richest countries in the world to being available in low and middle income countries. Even more recently, treatments like bedaquiline are still not fully available for MDR treatment in all the places where they should be used. COVID showed us, and even COVID was by no means perfect in how this worked. There were many shortcomings in the equitable access to COVID response tools, but on the whole, it was achieved, or the progress was made towards it at far greater speed than we've seen before. So in the context that we're in, with tight resourcing, lots of challenges from the broader context, from conflict, from climate change, from fiscal pressures, food and energy price hikes, and so on, it's all the more incumbent on us to be stimulating, sourcing innovation, and getting equitable access to these new tools as fast as possible. And I'm absolutely convinced that the way we're going to do this in fighting the deadliest infectious diseases is with the partnership of Unitaid and the Global Fund at the center. Thank you.
Thank you, Peter, for these very strong messages. Let's now hear from Philippe Duneton. Philippe, the floor is yours.
Hello, can you hear me? Yeah, thank you. Thanks, Marisol, Lady Ross. Thanks, Peter, and all the team that were working with us, not only for this event, but on a day-to-day basis. And that's the good thing is that I think that you have been setting the vision, and a lot of things have been said. So I do not need really to repeat it, maybe to flag maybe some key points. And of course, it's important to see the case that we will bring to us by colleagues today, that will highlight what we can do together, what we are doing together. So I want to insist in key points, and one thing is a unique partnership between Unitaid and the Global Fund, but it's also an inclusive partnership. The way we work is not just together, but it's the inclusion of the communities, and Maureen will talk about it. But also, as you mentioned, Peter, WHO, but also US bilaterals, but also the country. So again, building not only access to innovation, and I think that generally speaking, people don't realize the transmassive power of innovation, but we know, and I think it's important that to make the case and to show how it works. But also, again, as you said, Peter, it's very important that we can demonstrate and show how we can use every dollar that we have to have this maximum impact. And also the need for speed. I mean, you have been very eloquent on that, but I think that every delay in access to transformative innovation is in fact cost lives, as mentioned by Marisol. So again, the power of transformation of innovation is absolutely key. We have many examples that we will show you today. But I think that thinking about end-to-end solution is also thinking about not only the product, and they are important and they need to be affordable, but also how to use them. And I think that we have also built a lot of lessons we have learned over the last years, all together, Unitaid and the Global Fund and the partners, but also how to work with the communities. Look at the example of the test, the self-test, which was not a given even for me when we started, and how we can change for people access to tests, which is the first step to get access to treatment, not only for HIV, but we also looking for progress in COVID. We are looking for progress for TB, and we are not yet there, but we have to continue to push. I think I will end my remarks to say that it's really not only important, but how is it to work with you, Peter. It's really a pleasure. I think that we spend a lot of our first day evening together with the other principal, and we text to each other, and I have to say that it's not a surprise, but we are quite aligned. So it's important to be aligned as leaders, but also as organizations. And I think it's really how, and I think that's the vision we have, how this should work, could work better, is also with the experience we have fighting COVID-19, as you mentioned. We still are not done with that. And of course, we would want to be more fast in the response. We have made progress, including with oxygen, working together in partnership with others, with countries. It's also a lesson learned in terms of oxygen that it was not a priority for international global health. It was not a priority at country, but in fact, it was a pre-existing condition. And I think that with that kind of example, the vision, I think we need also to be prepared to address some kind of unexpected situation and for the better of people in need. So again, just to conclude, I think that's experience that have shaped the vision and the need to be more explicit, more proactive together. And again, inclusive is not just about Unitaid and the Global Fund, it's for the response. And to put as a priority, not only innovation, but fighting for equitable access. And we can be more specific, and we will be, but also not to reinvent the wheel every time we have an issue. Fighting infectious diseases around, of course, prevention, vaccine when we have one, but it's test and treat. And also, I think that's something that we will discuss not only today, but in the future, is how we make sure that in the pandemic preparedness, we have a strong connection between preparedness and response. Because at the end of the day, to be ready to respond is to have that connection with the real life and the need of the people in countries. Thank you for your attention.
Thank you, Peter and Philippe, really for underlining why this partnership is key and also for setting the vision. We will now move on and see a short video message from one of the key donors to both Unitaid and the Global Fund and a key contributor to global health. Ambassador Stéphanie Seydoux from France has the floor.
I cannot hear, I think.
2 seconds while we sort out the technical aspects here.
Dear Executive Directors, dear Executive Directors,
Okay, while we're sorting out the technical aspects, we would like to move on to Maureen Morenga, who's the founder of the Lean On Me Foundation and also a board member of Unitaid, and a passionate advocate of health, development and human rights of women and girls, to provide her perspective on the partnership. Maureen, please, the floor is yours.
Thank you very much to the organizers. Thanks to the panelists and for everyone who has made time to join us in this conversation. For us, this kind of a conversation is a win-win to our communities because our lives are saved, our pain is eased, and our dignity is given back to us. So if you look at the journey we have walked, the technology journey we have walked, we started off by, even if you wanted to have a HIV diagnosis, you'd take like 2 to 3 weeks to get your results, agonizing weeks, because it was a result that wasn't leading to treatment, but a result that was exposing you to stigma. And then after a while, we started receiving treatment that had very adverse side effects, like we developed lipodystrophy. We didn't look like we normally looked. The fat transfer made us lose our shapes and figures. And that, not only that, but our key organs were also affected with the harshness of the treatment. And that did not give us part of our dignity back. I think people still could tell us from a crowd because of how we looked with lipodystrophy that this one is on ARVs. And so with time we have, and it was even difficult for children because it took them 9 months to know their status. We didn't have the PCR or the diagnosis for children. And so for some, it was a lifetime. They died before they were diagnosed and put on treatment. And for others who survived, by the time they were diagnosed at 9 months, they were very sick and had TB, which was also even more difficult to diagnose. And then, so now we have rapid tests. It takes less than 20 minutes to get to know your HIV status. We have the self-test kits. We have the children are diagnosed. It takes like less than an hour. You can diagnose a child at birth through the point of care, early infant diagnostics. And so that has really turned the tide in that we are able to be reached very quickly and our lives saved. So to us, that is a really, really life-changing process. If you look at treatment, we used to have a concoction for HIV and MDR-TB you can't even explain. And they were expensive. They were very, very expensive. And so people also could not adhere better, especially if they didn't understand the timings and the names of the drugs, and sometimes they looked the same. So one would take a morning dose in the evening and an evening dose in the morning. And there's this lady who used to take at noon all the treatment for morning and evening, saying the morning ones will work backwards and the evening ones will accelerate forward, because she didn't know how to differentiate and she didn't get good results out of that. So having the fixed dose combinations, having the prices reduced has enabled Global Fund. Once Unitaid has negotiated the prices and bringing in generic formulation has enabled Global Fund escalate the number of people it has reached. And now it has reached many, many more people than we thought would have been possible. Mosquito nets no longer mean some meshy fabric around our beds, but they're actually preventing us from the deadly malaria epidemic, and our children can celebrate their 5th birthdays, most of them that could not during those years. So I think what the kind of partnership with Global Fund and Unitaid is such that when these commodities are made affordable, they are used better. I mean, they are better, easier to use and stuff like that. Then Global Fund can reach many, many more of us with the commodities. So it is a relationship of like someone cooking the meal and the other persons are helping to serve. And it's really a win-win for our communities. Though we cannot say our children are celebrating the same, because we have seen very slow progress on pediatric commodities. Diagnostics are still a challenge, even with the point of care commodities. The cartridges are still expensive, and therefore not many countries, not many children are being reached with these commodities. We are also seeing that treatment, they don't have many options. Right now, the almost optimal treatment is the pediatric DTG. So they don't have as many options as adults would have for treatment of HIV. So we are hoping that this partnership will also enable our children to have the smile adults are having in terms of HIV, TB, and malaria. And just like the previous speakers have spoken, time is of essence and time saves life. And this kind of partnership is the one that will get us to the ultimate goal of defeating these epidemics. Thank you very much.
Thank you, Maureen, for really also for reminding us for why we're doing this work and for your intervention and honest testimonial. We will try one more time with Stéphanie Sédou from France. And I'm looking to my colleagues to put up the video.
Dear Executive Directors, dear colleagues, I would like to apologize for not being able to join you for this important meeting. I'm honored to have the opportunity
let's go.
on the key subject of the Unitaid and Global Fund partnership. This is a top priority for France. Essentially, in order to reach the global health targets, the global response needs to be aligned and coordinated in order to be efficient. And this means leveraging the strengths of actors and working together to deliver. This is particularly true for achieving the Sustainable Development Goals targets, for which we also need a concerted push to ensure globally equitable access to health innovations, products, and approaches. And given the delay caused by the COVID-19 pandemic in achieving these goals, our efforts must more than ever be concerted. Now, the Global Fund and Unitaid have the same core mission to fight against the 3 pandemics, HIV, malaria, and tuberculosis. The funding for both organizations translates into massive impact in terms of lives saved and also savings to the overall global response. They have been working jointly ever since Unitaid was created 15 years ago, and Unitaid was created to assist and complement the Global Fund on two major functions: upstream market shaping and R&D. And indeed, Unitaid is the de facto market shaping agency, identifying the gaps and the market opportunities, negotiating upstream to push the prices down. And second, the Global Fund's dedicated R&D agency, making innovative products available to the fund for scale-up. Very few organizations can claim to work so closely and so well together. And this unprecedented partnership between Unitaid and the Global Fund is undoubtedly a virtuous example that could inspire others in the global health landscape. France is particularly proud and pleased to testify to this as one of the biggest donors of both organizations. We are convinced that this joint investment ensures maximum return to guarantee equitable access for all to innovations in diagnostics and treatments against HIV, tuberculosis, and malaria. There is a culture and practice of joint work at secretariats level with common roadmaps, priorities, and task forces. Today, beyond this, we see opportunities for more bridges, and we would encourage a more systematic participation at the level of both boards, starting with the Global Fund's systematic participation to Unitaid's executive board as a major technical partner. Also, the visibility of this collaboration must be more systematically brought to the attention of organizations, beneficiaries, as well as donors. And to better enforce this partnership is known and understood. The better, this partnership is known and understood, the more it can be supported. The work of the Global Fund and Unitaid is inseparable, and only if both organizations are fully funded can we collectively deliver on our promises to the people and communities to end AIDS, tuberculosis, and malaria. Unitaid's fate is vital to the success of the Global Fund. In this spirit, support for the Global Fund cannot be dissociated from support for Unitaid, whether political or financial. And this is the meaning of the proposal made by our president during the 7th replenishment of the Global Fund in New York, that replenishment efforts must be carried out jointly. The success of the Global Fund will depend on the full implementation of Unitaid's new strategy. The relevance of this partnership is, I think, well established. The question is how to best preserve, develop, and strengthen it. As members of the boards of both organizations and alongside their secretariats, we have a common responsibility to ensure the success of this partnership. I believe it is this spirit that brings us all together today. I thank you and wish you fruitful discussions.
Thank you, Stephanie, and thank you. This is also a good time to really thank France for its unwavering support to Unitaid and the Global Fund, and to global health in general. And with that, I would now like to turn to Johannes Hunger, Head of Strategic Information at the Global Fund, and Vincent Breton, Director of Results at Unitaid, to talk about the concrete impact that this partnership, together with other partners, brings to the global health response. Vincent, the floor is yours.
Thank you very much, Miriam, and good morning or afternoon, everyone. It's a pleasure to be here with Johannes for this session where we will try to give you a better sense for the impact innovations are making in our response to HIV, TB, and malaria. Of course, it is somewhat intuitive. Everyone here certainly appreciates that it would have been impossible to make the progress we've made in the fight against HIV, TB, malaria in the last 20 years without the right treatments or the right diagnostics being developed and made available in an equitable manner. What is maybe not always as intuitive, though, is how much additional value health innovation can still bring to the response to the three diseases. You see 5 vignettes on this slide, and each of them represents a distinct way in which innovations are making or will be making a difference. Let me go from left to right. Number 1, health innovation means that we have better products that deliver better health outcomes. For example, Unitaid and the Global Fund have recently introduced a new molecule as part of first-line regimens for the treatment of HIV. It is called dolutegravir, And dolutegravir-based regimens are more effective and less toxic than the previous generation of treatment. These better treatments result in lower mortality and improved quality of life for millions of adults and millions of children living with HIV. Sometimes we have very effective tools, but the parasite, the virus, or mosquitoes become resistant to them. This is what the second vignette is about. In these cases, we need to replace the product we use with other products that are not prone to the same resistance. The Global Fund and Unitaid are, for instance, working together to introduce a new generation of long-lasting insecticide-treated bed nets, as was mentioned earlier by Lady Ross. Health innovations are also critical when it comes to reaching out some of the most at-risk population groups. Why? Because they provide us with alternative ways in which health services can be delivered. For example, Unitaid and the Global Fund introduced seasonal malaria chemoprevention, which has proven very effective in reaching over 30 million children every year in the Sahel region during the rainy season and protecting them from malaria. Health innovation can also prove instrumental in delivering people-centered approaches, a concept that is at the center of the strategies of Global Fund and Unitaid. Think, for instance, about decentralized diagnostics or self-testing and how much difference they can make to someone's ability to be screened or tested conveniently. For example, Unitaid and Global Fund have introduced HIV self-testing, which is now enabling millions of people to test when and where they want without the fear of stigma or discrimination. Lastly, health innovations are also needed to deliver care in a more efficient and simple way. For instance, long-acting treatments offer the opportunity to move away from daily pills and multiple visits to health centers. They could transform the lives of millions of individuals in the next 5 to 10 years. Unitaid and Global Fund are already working together on the introduction of long-acting cabotegravir for HIV PrEP, and Unitaid is investing to make more products like that available across the 3 diseases. So as you can see, health innovations have a key role to play at many levels and in many ways. Now, you may wonder how big that role is. And let me hand over to Johannes, who will take you through the joint modeling work we've done to answer exactly that question.
Yeah. Hello, everybody. Thanks, Vincent, and good afternoon. Pleasure to be here. Let me just say that we did this joint work with the Unitaid team on the basis of the work that we have done in the context of the investment case. Now, you did already hear from Peter and others that one of the key results of the investment case analysis was the fact that we identified a minimum of 18 billion that was needed for the Global Fund to be able to get back on track to end the 3 diseases by 2030. There was also a projection that these investments would save 20 million lives on top of the 50 million that Lady Ross had mentioned in her statement, that we would avert more than 450 million infections between 24 and 26, and that those investments would yield a return on investment of 1 to 31, which means that every dollar invested would yield a $31 in return. In addition, investments by the Global Fund would catalyze a scale-up of domestic investments of up to $59 billion and reinforce systems for health and pandemic preparedness, and thereby reducing inequities in health services. At the heart of this work was a modeling exercise that tried to project the impact on the basis of the forecasted available financial resources. And on the right side, you see one of the key diagrams that were featuring in the investment case that showed the projected reduction in mortality over the period of the next Global Fund replenishment, specifically the implementation period, which is 24 to 26. And what you see in blue here on that right slide is the projected reduction in mortality across the 3 diseases based on a successful replenishment. And the specific rationale of asking for a minimum of 18 billion was that you see that it is at that level of resources that the projected trajectory becomes consistent with the trajectory of the global plans, which you see here at the end of 26. You see that those 2 trajectories start to overlap. Now, the investment case and the modeling underneath did assume that a number of relevant innovations that Vincent had already spoken about and that I'm going to list on the next slide in more detail are actually going to be rolled out and scaled up. So if you could move to the next slide. So this is where the joint work that we did with the Unitaid team, which by the way, I think is another really good example of a successful collaboration between the two organizations, started. So what we tried to do is to understand to which extent the innovations that are inherent in the investment case work, and you see them listed here on the bottom of this slide. I won't go through all of them in detail. The extent to which those innovations are linked to the impact that's projected in the investment case. And the way we tried to approach that question was to run a counterfactual scenario using the exact same models and the same model inputs that we had in the investment case, but actually project the impact in a situation where we wouldn't introduce those innovations. And I think some of the remarkable key findings of that work you see on the right slide here. What you specifically see, and that speaks very well to the topic of speed that we heard Peter, Philippe mention, but also I think all speakers did. You see that without the introduction of innovations, it would take more than 3 additional years to reach the same reduction in death across the 3 diseases. So you would have a delay here of more than 3 years in getting to that same impact, talking about the reduction of death here specifically. And it's clear, and Peter made that very clear, that time here means saving less life or averting less deaths if you're not rapidly introducing those innovations. Likewise, what we could see is that those health innovations enable a 16% more favorable return on investment. This translates in the specific scenario of the investment case and the assumptions there into an additional 17 billion US dollars in health gains and economic gains that you would realize over the 24 to 26 period. Now, these are only upshots of the work that we've been doing. There are much more details, but I think it gives you a somewhat quantified picture at a high level, admittedly, of the impact that innovations, at least the list of innovations that we have considered in this analysis, have in the context specifically of the Global Fund investment case work. Thank you.
Thank you, Johannes and Vincent, for this very clear and interesting presentation. I will now pass on to Robert Matero, Director of Program Management at Unitaid, who will introduce the next session and speakers and also lead us through that session. Robert, the floor is yours.
Thank you, Miriam, and thank you to all our participants today for joining us on this important session. So the next session is a very interesting session where we're going to hear testimonials from partners who are familiar, more than familiar, let me say, with Unitaid and Global Fund, and how we work together to accelerate and maximize the impact of the health innovations in which we invest. The first 2 testimonials will be from the 2 esteemed ladies you see on the screen here. We'll first hear from Leith Greenslade. She's the founder of Just Actions and the CEO, and importantly in this context, the coordinator of the Every Breath Counts Coalition. And then we will hear from Nikki Tyler, who's the acting deputy director of the Center for Innovation and Impact at USAID. And throughout the course of this pandemic has been the lead for USAID for Test and Treat and USAID's significant oxygen investments and contributions. So we're really looking forward to the 5-minute testimonials each of Leith and Nikki. And it's my great pleasure to start off with Leith first. So please come in, Leith. Thank you.
Thank you so much, Robert, for the introduction. So I'm coordinator of the Every Breath Counts Coalition, which is a very large public-private partnership, about 100 different organisations spanning the public, private and non-profit sectors. And I want to take everyone back to 2020, to mid-year 2020, with COVID raging across Latin America, Asia, parts of Africa. And really nothing being done at the global level in terms of an oxygen response, because what we were seeing at that period was oxygen shortages in hospitals, the long lines of people queuing up with their big cylinders trying to get oxygen to take home to families who were suffocating. And all the while these images kept, the tragic images kept appearing, the global response, there wasn't one. We had no real oxygen movement at the global health level. Understandable, because prior to COVID, there weren't that many organizations working in oxygen. And our coalition was very active in 2020, demanding one. Now, everything changed in February 2021, early in February 2021, when Peter Sands made a public statement, and I want to read it, in the Financial Times, because this really triggered a massive change. He said, vaccines alone are not going to do this. We could do a better job in saving lives by providing more of what we can currently deliver. In many places, the constraint is oxygen. Now, by the end of February 25th to be exact, we had an ACT Accelerator Oxygen Emergency Task Force nested within the therapeutics pillar, which is where it always should have been, because oxygen is a medicine. This was co-led at the time by Unitaid, because Unitaid was one of the few organizations that did have some expertise in their innovation portfolio with pulse oximetry and oxygen. And that was chaired by Robert Matiru, brilliantly chaired ever since then. And the great team at Unitaid, I want to call out Katerina Galuzzo and Ali Cameron, but there are many more. But this team at Unitaid has nourished this task force. Now, a few weeks later, after the task force was set up, we had the Global Fund step in with US government support and announce $3.5 billion more into their C19RM, and that oxygen was in scope. So we had a CEO step up and say this is a gap. We had the architecture put in place and finance coming through, largely from the Global Fund, within weeks in February 2021, February, March. Now, since then, in the last 18 months, that task force has mobilized about $1 billion in oxygen support to over 100 countries. And if you look at some of the independent evaluations that are starting to come up of the ACT Accelerator architecture, they're very critical, but take a look at what they have to say about oxygen and this partnership model. Now, it wasn't only Global Fund and Unitaid, WHO, UNICEF, UNOPS, World Bank, PATH, CHAI, USAID. This is a collaboration that really Unitaid has held together with the lion's share of the funding through the Global Fund. My final comments, our work is not done. Dr. Mike Ryan at WHO said that COVID ripped the Band-Aid off an old wound, which was lack of access to oxygen. So we know that the COVID needs for oxygen were great, but the non-COVID needs for oxygen are even greater. And that includes patients with HIV, TB, malaria, and many, many other causes and conditions. So it's our challenge now to keep this innovative partnership that really has been underwritten by Unitaid and the Global Fund alive to finish the job. So we're hopeful, our coalition is hopeful, we will transition this brilliant collaboration to a global oxygen alliance to continue this work. That Global Fund stays in the picture in the context of their health system strengthening agenda and their pandemic preparedness agenda, and critically that Unitaid, which has been like the glue for this whole operation, stays at the table to keep us all coordinated and to keep a bridge between innovation and program impact. This is genuine health system strengthening, because oxygen is a treatment for about 20 health conditions amongst the young and the old, men and women, both infectious and chronic conditions. This is the change I think the world is calling for in terms of our global health architecture, not just to do a few things very well, but to be able to invest in the interventions that have multiple impact across all the SDG areas. So I would encourage all the partners listening today to take a look at the oxygen partnership between Global Fund, Unitaid and others as a kind of flag for the future, a way we could actually work together in many other areas as we move forward into what is going to be very rocky waters for health and economic development over the next 5 to 10 years. Thanks very much.
Thank you very much, Leith, for so eloquently and powerfully delivering those key messages. And before I hand over to Nikki, I'd like to extend my thanks and the thanks of all the partners in the task force to how central you and the Every Breath Counts Coalition have been to that. And you've highlighted how this partnership between the Global Fund and Unitaid and all the other partners has been central to this story on oxygen access. And critical to any partnership is the ability to be held to account, to have assumptions challenged, and to continue to drive us to maintain the momentum. And we thank you for what you've done with the coalition in helping us to do just that. It's now my pleasure to hand over to Nikki Tyler. And as Leith has said, USAID has been so instrumental, not only in financing the global response to COVID, but in how much they have committed to financing oxygen through the Global Fund, but also independently. And we really appreciate the relationship we've built off of during the response with USAID, and we look forward to your intervention now. Nikki, over to you.
Great, thank you. Thank you, Robert, and thanks for the opportunity to be here. And I think as many of the speakers, it shows that we spend a lot of time together because we often channel the same messages and we all just feel passionate. So thanks, Leith, for giving a preview to some of what I said and saying it very eloquently so it's easy to follow you. But as folks may know, about 50% of facilities with inpatient services and LMICs lacked access to oxygen even before COVID. Some estimates place that even at less than 10% in Africa. And this is often something that those of us in high-income countries don't even think about. It's easy to forget that oxygen is an essential medicine that some people just don't have equitable access to. And COVID-19 really shone a spotlight on that lack of equity in people across the world being able to access such a basic essential medicine. And during COVID, as Lee said too, we saw just country after country that had deadly surges of COVID-19 in which oxygen just simply wasn't available. And we know that oxygen is needed for any patient with COVID-19 to survive. And we also know, as Lee said, that oxygen is just, again, an essential medicine that has many other roles in health system strengthening outside of COVID-19. So that's where we, and on the point of multi-stakeholder collaborations here, really got together because everyone, including partner governments, donors, implementing partners, multilaterals, the private sector, which is so important here, really had to get together quickly in early 2020 to figure out how we could get out oxygen to countries that needed it, and also how to do it in a sustainable way that would build health systems so oxygen would be available for years to come. So, excuse me, I have a cold. So at the beginning of COVID, I would say that the multi-partner collaboration happened fairly organically and ad hoc. Many of us had existing relationships where we would get together and try to solve for what we knew would be this huge problem. But it was incredibly, incredibly clear that no one organization could do it all, nor did anyone have the resources or the expertise to do it all. So we were really lucky to be able to build on existing collaboration that had happened already. Nigeria and Ethiopia, as an example, had published oxygen roadmaps that we could use as best practices. Leith, of course, was an integral player with Every Breath Counts, and other partners like Unitaid and USAID had done some work in oxygen. But we really needed someone to step up and take a leadership role on oxygen, and that is where we really saw Unitaid come in, lead that oxygen task force that Leith mentioned, and bring partners together to think through strategically what we could do together and how we could move forward as one to meet the needs of just the gaps in the oxygen landscape that we saw. Of course, both Unitaid and Global Fund brought very important complementary skill sets and expertise to this. Unitaid, again, was a champion of oxygen even before COVID-19 happened with some of that pulse oximetry work. They had a great mapping of implementing partners that had done oxygen access work as well that folks could build off of. And Unitaid, again, and we said this too, was really able to just build inclusive partnerships that brought everyone together to figure out how we move forward. I also would say just a skill set that Unitaid brought was around strategic risk taking. And as a team that is an innovation team at where I sit in the Global Health Bureau, just incredibly important to think through how we can more strategically take risks with the private sector, do some of that market shaping, think through innovative financing techniques. And Unitaid really brought that specific skill set and expertise to the forefront of any conversation in oxygen. Global Fund, of course, speaks for itself in what it brought to the table, just formidable resources with C19RM that could be leveraged, targeted TA that was provided in countries around what type of oxygen supply source could be best. And also, I would say just for all partners, including Global Fund and Unitaid, we all just brought a really strong willingness to learn from one another in terms of what is working well and what isn't. And I think that open and transparent collaboration that all partners had was critical, so we could build trust and just work together and say, this is not working in Zimbabwe, let's try something else. So I think that was just an incredible, important part of the partnership. And as we look forward in oxygen, hopefully we're at a place where the deadly surges will have abated. We don't know, we'll see there. But I think what we have seen again is that oxygen has been, as was said earlier, just there wasn't focus on it on the global stage until COVID-19 shone that spotlight on it. And we know it's important for other critical health needs such as child and adult pneumonia, safe birth, safe surgery, the list goes on and on. So with any crisis, there's of course opportunity. And I think it's important to think through how we use the crisis that COVID-19 was and is to build opportunity for what had been neglected health areas and how we build equitable access to all medicines, including oxygen. And I was just speaking to Atul Gawande about this yesterday in terms, and he's the head of the Global Health Bureau. And he mentioned that from his viewpoint, one of the most salient successes of this pandemic could be that there was just unprecedented multi-stakeholder collaboration across the board, across folks who have worked together. But because of COVID-19, we really needed to come together even more strategically and share. And one of his takeaways from the pandemic is how can we use that COVID crisis to make sure that we're charting forward these partnerships as we did during COVID, as we did during oxygen. So I echo that sentiment of Atul Gawande. And also echo what Lee said is we still have work to do. We haven't solved this, but we're closer. And how can we continue to build on the opportunities that came from crisis to just ensure equitable access to medicines like oxygen moving forward? Thanks, Robert, back to you.
Thank you very much, Nikki, for your testimony as well. As we move to the next three, just to reiterate that we have an amazing foundation to build off of, lots of achievements to build on, but we know to sustain all of this, the immense challenges that we have to still resolve. And together with the Global Fund and many, if not most of the partners in the room here and those that aren't, so long as we build on the spirit of partnership and build on each other's comparative advantages, we believe this is eminently doable. It's now my pleasure to move to the second part of this session, and we will hear testimonials on the one hand from Dr. Tato Chidarikire, who's the Director of HIV Prevention Programs in the National Department of Health in South Africa, and her colleague Hasina Subedar, who's a Senior Health Advisor in NDOH in South Africa. So together they'll talk about our past collaborations in the context of Global Fund Unitaid collaboration, before we then move to Mitchell Warren, the Executive Director of the AIDS Vaccine and Advocacy Coalition, who will give us a bit more of a forward-looking perspective on this collaboration when it comes to long-acting PrEP. So over to you, Dr. Tato and Hasina, for the first intervention. Thank you.
Thank you. Thank you. Good afternoon and good morning. I'm Tato. Let me just say all protocol observed, and thank you to Unitaid and Global Fund for inviting us to this very important meeting. I'm not sure if our video is showing or it's just audio, but I'll continue nonetheless. So I think I must say that South Africa benefited immensely from the catalytic support that we received from Unitaid as we participated in phase 2 of the STAR initiative on HIV self-testing, which we refer to as HIV self-screening in South Africa. From 2016, as we updated our guidelines to actually align to WHO with regards to closing the testing gap, we really embraced HIV self-testing at the time, but with the participation in STAR in 2017, we then moved on to actually implement. We had a target of about 2 million, which we achieved and exceeded. 2018 passed and we developed our guidelines, and then through to 2020, as we had our investment case and continued to implement, we then ensured that we have actually procurement of HIV self-test through domestic funding. We procured about 600,000, we continued to implement, and we still continue to implement as we speak. And I think I can safely say at the moment, as we move towards our next procurement in 2023, we are hoping to procure about 1 million just as government from domestic funding, and we'll get support from Global Fund and also a bit of support from other partners. I think I will pause it here and let Hasina talk to PrEP. Thank you.
Good afternoon. Apologies, for some reason our video doesn't want to come on, but we will proceed. I'm going to share very briefly how we've scaled up oral PrEP with the support of Unitaid, Global Fund, and some of the other donors that have supported us over the past few years. As of July 2022, South Africa has had over 658,800 HIV negative individuals who were initiated on oral PrEP at over 3,000 of our public facilities. And this was since June 2016 when we first started the intervention. And you know, this has been largely because of the support that we have received from a number of different sources, including Unitaid. When we first commenced oral PrEP, offering oral PrEP to HIV prevention as an HIV prevention intervention, we considered the WHO guidance that was released in September 2015, and we convened a technical working group which comprised of a number of different partners, all the different donors, clinicians, researchers, civil society, health service providers, and economists. And at the outset, you know, we started very small with only 13 facilities in June 2016, and subsequently we have grown now to over 3,000 facilities that are implementing oral PrEP. One of the big challenges for us was offering oral PrEP to adolescent girls and young women. And there was a lot of hesitancy, especially given that this was not going to be an easy feat to offer oral PrEP, which was a new intervention, to young people. And at the same time, South Africa was faced with high rates of HIV infection amongst adolescent girls and young women. We had approximately 1,750 new HIV infections in a week amongst these individuals. And there was an urgent need for us to come up with interventions that work, interventions that would be effective, and interventions that will curtail these high rates of HIV infection. Unitaid at that time engaged with the Department of Health and made available a grant to look at how can we develop innovative approaches to reach young people. And initially, the project focused on 8 public primary healthcare facilities to reach over 6,600 adolescent girls and young women. This project aimed to support the Department of Health to expand oral PrEP as part of comprehensive health services by generating insights, evidence, and conducting implementation science research that will be used to develop innovative approaches to strengthen HIV prevention and sexual reproductive health services to adolescents, and looking at having a very specific focus on facilitating adolescent and youth-friendly services so that we can make sure that we attract young people. This project has since developed a number of rather innovative approaches that have resonated with young people. An online risk assessment tool that young people can assess whether oral PrEP is something that they would benefit from, an online testing tool to test to support self-testing and self-screening. Also having a chatbot, Sister Unati, who's our chatbot, provides a lot of support to young people to answer their questions and to direct them to different services that they may require. And then also just to say that out of all of these innovations that we have, they have been incorporated into existing Department of Health mechanisms like the BeWise platform. I think the other very important innovation that we have seen through this project is looking at social mobilization in rural, in urban and peri-urban areas. And this has really impacted on the uptake of oral PrEP amongst young people in those communities. Unitaid, the Unitaid project also partnered with MTV Sugar to look at promoting oral PrEP and HIV self-testing using a TV series called MTV Sugar. And this was very successful in creating awareness amongst amongst youth on health-related issues. And what also really benefited us was to actually look at how do we utilize these actors from the MTV Sugar series to mobilize more people through social mobilization events and through social media. And although the Unitaid project was only in 3 provinces and 8 health facilities, the impact of the insights, learnings, and evidence generated through these projects were far-reaching. Firstly, the project generated real-life examples from our public health facilities. And I think this was quite important to make sure that we actually get there. And secondly, just to say that the partnership that Unitaid is now developing with Global Fund to expand long-acting HIV prevention products and the foundation laid by Unitaid will really take us a long way further. Thank you.
Great. Thank you so much, Dr. Tatu. Thank you, Hasina, for giving us those concrete examples of how over the past years, the investments Unitaid has made around innovation and investment and implementation science have positioned scale options for HIV self-screening and PrEP in South Africa, real concrete examples. Now we're going to hear from Mitchell, and he's going to give us a perspective of how exactly these type of partnerships could position the potentially game-changing long-acting version of PrEP therapeutics that are coming out. So Mitchell, over to you.
Great, Robert, thank you so very much. And I want to thank Unitaid and Global Fund both for their partnership and their teams for really helping to translate a lot of these big ideas, these big visions, and these mission statements into practice. And I just want to take a minute to thank Peter and Philippe particularly because leadership matters. And we all know that. And it's not always demonstrated, and you see that from their remarks earlier in this session. I'm really delighted to be part of this, and particularly to follow Tatu and Hasina, who are great friends and partners in this work, to really talk about what the future could look like and how we might do better than what has happened in the past. And as many of you will know, we actually are over a decade since we celebrated the first pre-exposure prophylaxis option, oral PrEP, a daily pill. And as Hasina described, South Africa, thanks to Unitaid and many other partners, has been a great success story in all of this. But I often say we should never confuse progress with success. We've had progress globally, but I would argue we have not had the success at a global level that we need. There was a hugely ambitious UN target to get millions of people access to oral PrEP and to really translate exciting science into impact. And as a global community, I would argue we have failed. We have gone too slowly, we have gone too small. And the good news is, as a community, I think we are very much a learning community. We're learning from the experiences of Unitaid and the South African government. We're learning from the experience of self-testing and really thinking about a future that might more rapidly accelerate the translation of science into impact. And as many of you will know, just last year, we got very exciting results about the first long-acting pre-exposure prophylaxis option, an injectable PrEP agent that came in 2 trials. Hugely successful science, and I think we all recognize the need to go much faster than we did with oral PrEP. And in the midst of that, Unitaid, Global Fund, and a number of other partners have really looked at how we take innovative products through innovative programs, and to do that, really the need for innovative partnerships. And again, I think it's important that we never rely just on the products alone, because whether it's HIV or TB, malaria, or any disease area, the products alone don't magically appear if we don't have the programs to deliver it. One of the great models in this actually was work that Unitaid did with a number of partners in developing the Program Advisory Committee for Optimal ARVs, convened by Unitaid and USAID with the Global Fund and WHO to really look at how to bring stakeholders across national, bilateral, and multilateral agencies, along with communities, into dialogue to accelerate access to optimize ARV treatment. So a number of us look at the experience of oral PrEP, the experience of HIV self-testing, the experience of that Program Advisory Committee, and just in July at the International AIDS Conference in Montreal, collectively launched the Coalition to Accelerate Access to Long-Acting PrEP. This is a program convened by Unitaid and Global Fund, along with WHO, PEPFAR, and UNAIDS, with AVAC, the organization I lead, as the secretariat. What's really exciting is a recognition that this is not just about agencies and funders. AVAC is an advocacy organization. Embedded in this work is civil society. Going back to what Maureen said at the beginning of this conversation, no one agency can do this alone. This coalition is really, it's ambitious. It's a big idea, but it's essential if we are going to really see us meet our targets. It's easy to set targets to say we want to reduce the level of new infections by 2025. Too often we set those targets and we reach the end of 5 years and say, oh, we missed those targets. The idea behind this coalition is structured that as global agencies, but nimble enough to get the work done, because we have got to be sure that we don't come in 5 years and say, oh, we missed our target to roll out long-acting PrEP, and we haven't advanced our mission on accelerating incidence reduction in HIV. We've got to be doing this in real time. It's an innovative structure that has working groups led by different agencies and global. This conversation
Sorry, can Hui and Janet, if you...
Sorry,
Eastern organizations, not involvement, and NHS involved. The gate. Can you hear me all right?
Mitchell, your line is breaking up a bit. You're off video now.
Keep being muted. Can you hear me again?
Yes, yes.
Okay. I keep being muted. I think it was as we had at the beginning. Apologies for that. I think my video now stopped, but all of this to say, the idea behind this coalition, 5 things: to lead with equity, than we've done in some other areas, and to make sure these innovations reach the people in greatest need. To do that, we have to center the communities and the users at the outset, not as an afterthought or as in the end of the line. This has to be centered at the beginning. We have to, throughout this process, think about scale and speed. We as a global health community sometimes get stuck in pilot programs and small scale implementation science, and we don't necessarily apply that at scale. So the work of this coalition is to look at accelerating scale and speed. The 4th item, to deliver with impact. This is not about getting people on PrEP. This is about incidence reduction. We must have impact. And finally, there's a great deal we don't know. How to deliver this product, how to build these partnerships, but we have to work with what we know while we continually add to the evidence base. And again, that classic, not letting the perfect be the enemy of the good, to really move forward in a collaborative basis. So while the other stories were ones that showed you what's actually happened with oxygen and with HIV self-testing and oral PrEP, the work I describe is aspirational, but it is essential if we are to meet our global targets together. So with that, I'll turn it back to you, Robert, and just thank you for your continued involvement and leadership in this regard, and look forward to the conversation.
Wonderful. Thank you so much, Mitchell, for that. And moving forward with this coalition, moving forward with what could be transformational work in bringing the first long-acting therapeutic for HIV forward is going to be absolutely essential on the backbone of partnerships like the one we're describing today and many other partners that will make it real. So in the interest of time, I thank you again, Dr. Tato, Hasina, and Mitchell, and I'm going to hand over to Janet and Hui and Michael for the next session. Over to you.
Thank you. I'm just going to join my thanks to the panelists for the powerful intervention, and we'll hand it over to Janet Guinard, Director of Strategy at Unitaid, and Hui Yang, the Head of Supply Operations at the Global Fund, who will speak to the complementarity of Unitaid and the Global Fund, some of our shared track record, and the joint priorities going forward. Janet and Hui, the floor is yours.
Thank you, Miriam, for the introduction, and it's a pleasure to be here today. I'm Janet Guinard, Director of Strategy at Unitaid, and together with Hui, I'll offer a few final reflections on the Unitaid-Global Fund collaboration. 3 things we wanted to underline, and we have just 3 slides here. First, that our work is complementary and contributes to shared goals. Second, that we address collective priorities together with partners in each area. And third, that this collaboration is practical and inclusive. We know what to do and can get the job done, and we have a track record of success, different models to draw from. So this first slide maps out how Unitaid and the Global Fund each contribute to fast product introduction and equitable access. I won't go through this whole slide, but it's just to show that it requires an end-to-end approach to realize all aspects of functional markets, from innovation through to demand and adoption. Market shaping plays a valuable role at all levels of product introduction and scale up, and requires a concerted effort across a range of different partners. So there's really no one organization that can deliver the whole range of activities in isolation. But Unitaid has a unique market shaping toolbox, activities that it's best placed to support that speed access to innovation and which complement the efforts of the Global Fund. So you'll see here Unitaid activities, a few illustrative ones on the left-hand side of the slide: landscape monitoring, late-stage product development, evidence on models of care, early introduction, and community-led demand creation. For some of the activities that are shown there in the middle as shared, our work nonetheless reflects each organization's comparative advantage. To make products more affordable, for example, both Unitaid and the Global Fund can drive price reductions with market shaping incentives. Unitaid's focus tends to be more on early stage pricing, access provisions that can be secured as a condition of market creation. The Global Fund can exert formidable leverage with smart procurement, and so working together, we can have real impact. This map, as I said, is not exhaustive. While Unitaid and the Global Fund each put a unique contribution forward, we also work with many other partners not shown here, many of whom have been mentioned by prior speakers, so thank you for that. This map is also not set in stone. Our approach is flexible and strategic, depending on the requirements of each intervention, and above all, complementary. So with that, I'll pass over to Hui for a few additional remarks on this slide and transition to the next. Hui, over to you.
Thank you, Janet, and hello, everyone. Just to build off through this complementary approach, what are we trying to achieve is to further streamline the activities that are being done and carried out by Unitaid and the Global Fund, and to ensure smoother transition from product innovation to introduction and to scale. This is particularly critical from the country perspective, as the country readiness and preparedness to scale new health products require good planning, coordination, and technical support. The Global Fund's comparative advantage lies in multi-year funding grants and procurement scale, as already mentioned by Janet, as well as the well-functioning country coordination mechanisms. So together, this allows us to drive better demand planning and forecasting and enhance pool procurement partnerships at the global, regional, and national levels, accompanied by country system strengthening interventions. The ability to complement each other's works, both with Unitaid and across the partnership ecosystem, will be one of the most critical, if not the most critical path to success, particularly when needs are huge and resources are limited. For any health product that would be prioritized for introduction at scale, it would need to meet efficacy, effectiveness, and efficiency criteria and be fit for purpose and fit for use to drive a sound return on investment to make the Global Fund investment go further. On the next slide, we will share with you the latest product pipeline mapping across the 3 diseases with the input from the disease partners and prioritization that are well underway. Before I turn to Janet to speak more about the process itself, just want to again call out why is it important that we work with disease partners to move about the multi-year product pipeline. Number one, it will help to provide the visibility. Number two, it will drive more effective prioritization efforts, both within each of the diseases as well as across the diseases, and would help us to drive a culture of innovation through better engagement and more consistent communication. How do we want to leverage the multi-year product pipeline? First, we need to understand this, the product pipeline is dynamic and will require regular review and update with the disease partners. It would need to be leveraged to inform the prioritization discussions, and it needs to translate into the specific use cases, investment plans, including sound implementation roadmaps, which is work in progress for the product that have been shortlisted by the disease teams and marked here on the slide with the star. With the limited resources, we need to focus on products with the base value proposition, those that would have the biggest impact on our return and return on our investments. So with that, I transition to you, Janet.
Thank you, Hui. As mentioned, this is a simplified view of the pipeline of emerging products with a focus on the near term. It is not static. It's also not done in a vacuum. It's rapidly evolving, changing, trying to reflect a lot of very dynamic conversations that are going on. At Unitaid, we work with WHO, country stakeholders, others to diagnose the evidence gaps, the constraints, the roadblocks that could hinder or slow down access. And we work in partnership to address those. So we have a new strategy. Unitaid's new strategy outlines programmatic priorities, and we have a robust framework for prioritizing the work based on impact and the change we can make. But we found that this naturally translates into collective priorities and a shared vision, shared ambition, and a view to sustainable impact with a focus on some of the products and collaborations that we've shown here. But in fact, it's not theoretical, this partnership. It's a reflection of very real collaborations over the past 10, 15 years. So if we go to the next slide, I can start with a glimpse of these. There's not really any one-size-fits-all approach. We're dynamic, we're flexible. We have a range of models in mind that we draw on from past collaborations that have delivered impact. So some of the examples you heard about earlier, many, many more, including new nets and seasonal malaria chemoprophylaxis. Those are among our most effective, highest impact, most life-saving efforts ever. And there's, as I said, a whole range. Some are independent but complementary pieces of work. Some are formal joint projects. Some are more of a coalition approach there at the right-hand side. They all include market shaping working groups, steering committees, program advisory committees like the one that Mitchell just mentioned. And we have found that when we can be very clear on what Unitaid plans to do, what Global Fund plans to do, how those efforts are complementary, then that clarity can allow others to crowd in a very complementary way, in really an inclusive way. In any case, we've found approaches that work and that have created markets and accelerated access to HIV self-testing, TB prevention, malaria prevention, COVID tools and oxygen, and better HIV treatment. And as was mentioned at the outset, faster equitable access saves money, but more importantly, lives. So I'm very excited about the many past collaborations we've had together. As I mentioned and has been called out a number of times throughout this session, this is about the focus on Unitaid and Global Fund working together, but we really rely on so many partners that are operating in each of these ecosystems to really realize success. So thank you very much, Hui. Back over to you to close out this part. Thank you.
Sure. Thank you. So as Janet said, we need to do this more. This partnership needs to do. We need to do this more intentionally and more efficiently, and it would require a different approach by product, and would require a focused partnership effort. So again, the Unitaid and Global Fund's partnership task force should also act as a thread and leverage existing partnerships. And then we also welcome a partner to crowd in with their unique contributions and leveraging their comparative advantages for specific use cases. So also through the partnership task force approach, we want to shift from seeing health product introduction as being a kind of a nice to have choice, but really transitioning it to be a mission critical intervention and strategic choices that we must take together and across the partnerships. So to make this shift happen quickly, we need to come together again, and then we need to work together, and we need to drive this important effort together. So with that, on this inclusiveness, I would also like to then introduce my colleague, Michael Byrne, who is the head of the technical advice and partnership department at the Global Fund, and who would be, just to share some thoughts on inclusiveness and community engagement on this important work. With that, over to you, Michael.
Yeah, thanks, Hui. And as you said, I mean, community engagement is critical for success. And by that we mean the communities, community groups, people living with the diseases, especially young people, and civil society organization. And as Maureen highlighted earlier on, in terms of what products are needed in that product landscape that you're showing, to advise us in terms of how people can best access those products in an integrated, people-centered way, as you heard on the prep on the South Africa example. And also we've stepped up significantly our community monitoring to have really frank and honest feedback in terms of how new products are being received and supporting us on course correction. And the other part we've also seen in South Africa has been the work with civil society and communities in advocating to government and other actors on getting the right enabling policies and on sustainable financing. Thank you.
Thank you, Janet, Hui, and Michael for your intervention and for this presentation. We will now move to the last part of this session with a panel discussion moderated by Tenu Avafia, the Deputy Executive Director of Unitaid. Tenu, the floor is yours.
Thank you very much, Miriam, and good morning, good afternoon, good evening to everyone, depending on where you're joining from. I have the pleasure of moderating what will be quite a brief discussion between colleagues from Global Fund and Unitaid. As you will have heard, we've had a very rich discussion so far, the consequence of which time is not on our side. Nonetheless, we'd like to do a very quick Q&A. And for this virtual roundtable, I'm joined by some of the speakers you've been hearing from earlier today, Janet, Hui, Robert, and Michael. So I'd like to ask each of you a question, but given the time constraints, I will ask that you please try and keep your responses down to about 2 to 3 minutes each so that we can hear from each of you. And if you're okay with that proposal, let me start with you, Janet. We have heard from many sources, just about every speaker today, about the strong partnership that exists between Global Fund and Unitaid on a very wide array of areas. My question is, how do we prioritize these areas where Unitaid and Global Fund work together? And more specifically, it'd be great to hear how decisions are made around which diseases, products, and partners we work together on. Over to you, Janet.
Sure, thank you, Tenu. We're trying to reflect the existing priorities of the response. So we are working with WHO as technical and normative leads on setting guidelines, on understanding what evidence gaps there are, and in particularly communities and country stakeholders to determine what priorities should be reflected in the response. So we're not setting priorities per se, but aligning on the best interventions to respond to those. We, being Unitaid and Global Fund, see how together we can define what we can do, what change we can make, and where we can work together in partnership to make a change to go further and faster with new tools, greater equitable access. Thanks.
Okay, great. Thank you very much, Janet. And I understand there's some echo on the line. I hope I'm audible to most of you, if not all of you. Let me turn over to you, Hui. So one of the take-home messages I've certainly heard today is the importance of a fully funded Global Fund, a fully funded Unitaid, and more broadly, a fully funded global health response. And while I imagine everyone on this in this virtual room fully agrees, we've also heard from Peter, we've heard from Philippe and others that the current funding environment is challenging and is likely to stay so in the short term. And so within that, we've heard some start to say that we need to look at potential trade-offs. Now, if we all agree that innovations are key to ending the three pandemics and co-infections, What is your perspective on how we sustain our response in this complex funding environment?
Thank you, Tenu. And I think that the question of this trade-off or trade-offs decisions, I would always think that instead of the trade-off decisions, we need to focus on the prioritization efforts together. And we need to do that not in the isolation, but really take a very holistic and consistent approach across the disease innovation and health product introduction, and as well as the system strengthening interventions, as I mentioned earlier. We need to continue to focus on holistic solutions, because only a holistic approach to a solutions would yield into the best return on the investment, i.e. to achieve better performance compared to the existing solutions. And that can come in many different form and shape, and some of it we hear already earlier from Vincent and Johannes. It can be something in simplification or simpler in use, and also important, the focus on prevention is critical. And because prevention of an infection is still the best and the most cost-effective way to save lives. And the solution also can be leveraged across the three diseases. That's why a lot of the market-shaping interventions, why they are often dedicated and focused on one product and one specific diseases, but there is a lot of value looking this across the three diseases. So one of the good example would be multiplex platforms approach on diagnostics, something that we will be continue to explore and to develop. So I think as part of the prioritization effort, there needs to be also deprioritization. And however, to do so, we need to be absolutely clear and upfront about what are the implications if we are not to take any actions or do something, and be mindful of what are the real costs and opportunity costs of those of the consequences of those decisions. So finally, for every product, let me again remind, through the prioritization effort that we introduce, we need to have a very clear exit strategy as well. So, and then to ensure the sustainability of the innovation that we introduce and the health product we put to the countries and we want to scale up in the country. So with that, back to you, Tinu.
Oh, thank you so much for that, Hui. And I suspect this is a topic that we'll be returning to in the coming months. But thanks for your answer. Okay, let me pivot over to you, Robert. We've had some very informative and powerful presentations or testimonies, if you will, on oxygen as well as on HIV. We would love to hear a little bit more, if you can elaborate or unpack what exactly the synergy was in the partnership between Global Fund and Unitaid on this work, and where you see the enduring complementarity for future collaborations in this space.
Thank you, Tenu. I think these two sets of testimonials were highly illustrative of the added value that our two organizations can bring alone, but how much more that is amplified when they complement each other. In both cases, we saw that each organization had a specific role with respect to, in the case of HIV self-testing and PrEP, laying the groundwork through implementation science, operational research, early demand generation, catalytic procurement for Global Fund in partnership with the government of South Africa, together with PEPFAR and others, to then position those interventions for scale with respect to the populations that were being prioritized and targeted, adolescent girls, young women, and others. And that was really critical to positioning those innovations for scale. The fact that each organization has a specific role means that we can indeed meet in the middle, and it does allow for a seamless transition for introduction to scale. If you look at oxygen, here again, Unitaid and its model, and our model is inherently predicated on partnerships. We work with more than 50 implementing partners across the world who have boots on the ground, who have deep relationships with governments and civil society in country. We leverage those partnerships to work with CCMs and proponents to ensure that the proposals that the C19RM mechanism was calling for very rapidly were actually rational and fundable. Prior to that time, on the one hand, there wasn't money until the US government stepped up with 3.5 billion for C19RM. And two, there weren't fundable propositions. What was coming up at that time to the World Bank and others was not deemed fundable. So Unitaid's partner network and expertise ensured that what was requested from C19RM could ultimately be funded once the Global Fund's mechanisms, its TRPs, looked at that and determined they could be funded. Associated with that was obviously the partnership at the global level across the Oxygen Emergency Task Force, where different partners came together to help align behind an investment strategy on what to prioritize across liquid, across PSAs, across concentrators, across technical and capacity building. And that was really important too. So that is also illustrative of the complementary roles that we both played. Moving forward, as you asked in the third part of your question, I think it's really important that we continue to, as we build out a roadmap of collaboration for the next few years between Unitaid and Global Fund, deepen the understanding between our organizations at every level. The executive level is already great, as Peter said, with Philippe, but at the governance level between our respective boards and supporters to those boards, at the secretariat level, and then in country. And while Unitaid doesn't have country presence and Global Fund neither, we have mechanisms and partners therein who are really critical to building out bottom up the areas we'll invest in and the propositions that ultimately come to be funded. And that will be really crucial, because inherent to the strength of this partnership is again, mapping out very clearly how we can complement and meet in the middle while our respective roles are played out on either end of that spectrum. So thanks for that opportunity, Tenu, and we look forward to doing exactly that as we move forward with this partnership. Over.
Great, thanks so much for that, Robert. And yes, indeed, we've heard increasingly about the need for sustainable and efficient and optimal partnerships, and it's a recurring theme in global health and one that I think will remain. And so given the complexity of the operating environment and the multiplicity of partners in country context, I'm turning to you, Michael, to ask how, if you have some suggestions around ways that we can really optimally leverage our partnerships, building on what already exists, but then also providing inclusive platforms to integrate our collective efforts. Over to you.
Thanks, Tenu. So I think one of the most important things around our partnerships is the focus, the joint focus on results. It's the impact imperative. We won't achieve the 2030 targets unless we innovate on health products and the complementary improvements that we heard, like in South Africa, on service delivery. And just to highlight that in the current economic challenges that we have, the strain we're seeing on the health budgets in low and middle income countries, antimicrobial resistance, climate change, and the migration attached with that, it's ever more important that we boost results and cost effectively through innovations and new technologies, and not take a step back because of constrained funding. For me, in terms of our partner engagement, and what was important in terms of what Janet and Hui highlighted earlier, was that dynamic alignment on the new products landscape and the pipeline over the short, medium, and long term, so that we agree on which are the products, the winners, that we want to pull through that will make the greatest programmatic difference to the people we serve. As many have said, we'd have to be just really practical and efficient. Things are just really so busy. So a lot is around relying on each other's and identifying and discussing each other's respective mandates to generate the synergies and avoid duplication. And as part of that, I think I've seen too how it's important to leverage the existing platforms that we have, rather than try to build many new ones, which can be less efficient. And I think an example can illustrate a lot of this. And Lady Ross talked earlier about the work of Global Fund and Unitaid on the new nets that we're introducing. And this work also involves Gates, the US government, and WHO and other partners. And our partnership here has generated evidence for a positive WHO recommendation. We've expanded manufacturing capacity and lowered the prices for these new generation of nets. And our prize here is that for a family with this net, it halves the malaria incidence and prevalence compared to standard alliance. That's a huge win. And the success factors here for our partnership was a very clear strategy with a detailed work plan and clear commitment that we were going to deliver this. And as part of that, a lot of dialogue, because this was a constant alignment as we went. Another really important lesson was that you need to work the upstream and downstream in parallel. It is a mistake to leave the country engagement until later. It's a killer for acceleration. Another part was the mechanisms that we had to address bottlenecks and challenges early on and head on. And that was a lot of difficult discussion, disagreement, but it did mean that we did action on the challenges we had on the supply side, on the pricing, on the pilots, the evidence that was needed for the WHO recommendation, some of the challenges on the national regulations. The WHO recommendation for new nets is expected in the new year, and after our replenishment, we will have the financing to take these new nets to scale. And let me say, as part of that, particularly for today's event, just the Unitaid-Global Fund partnership has never been this closer. And I really want to thank particularly Philippe and his team and Hui for that. And we are really excited on what we can achieve together with all the other partners here. Thank you.
Great, thank you very much for that. As I was saying, time is not on our side, and we have a hard stop quite soon. I saw two questions, very important questions in the Q&A column. Just to note that they have been duly noted, and that post the event, we will certainly be reverting with some answers on those. And then also there's been a very lively chat, which again, we're definitely taking note of the comments as well, because they're very rich, and this will definitely help to inform our next steps from this. So at this stage, I'd like to turn over to His Excellency, the Vice Minister of Health from Japan, Dr. Eiji Hinoshita. Dr. Hinoshita, we're delighted that you are able to join us to provide some reflections in offering some closing remarks. The floor is yours, please.
Mr. Peter Sands, Executive Director of the Global Fund, Dr. Philip Denneton, Executive Director of Unitaid, distinguished panelist members, I'd like to express sincere appreciation to the Global Fund and the Unitaid for co-organizing this partnership event, and also would like to thank all the inspiring discussions shared today. I'd like to briefly discuss Japan's vision on how global health challenges would benefit from greater coordination among global health actors. I would like to underline the need for greater coordination among organizations fighting against global health challenges. A positive opportunity of this is coordination and complementary work among global funds, Unitaid and Japan's GHET Fund. Needless to say, it is also important to complement and synergize between multilateral support through international organizations and bilateral assistance provided by JICA, among others. GHET Fund works on the research and development of drugs, vaccines, and diagnostics for neglected tropical diseases, malaria, and tuberculosis, in coordination with Japanese pharmaceutical industry, universities, research institute, and Unitaid. The respective role of Unitaid, the Global Fund, and the GHET Fund are essential to achieve a more efficient and comprehensive global health response. While GHET Fund works on the research and development innovation segment and the Global Fund on achieving scale, Unitaid is key for providing equitable access. Access strategies, the key mission of Unitaid, is the missing link between the innovation phase made by GHET, for example, and the scale-up phase by the Global Fund. I believe that coordination and complementary work among these organizations will contribute to the enhancement of access and delivery to new medical products, not only for 3 infectious diseases, but also for NTDs. Also, this is one critical enabler to the achievement of universal health coverage. Our experience over the last 2 years made it clear that today we must focus on clearing bottlenecks in the global health response. In particular, we need to collectively find answers to major issues such as strengthening regional capacity, surveillance, early warning systems, vaccine research and development, and of course, access and delivery, all of which are connected to and benefit from innovation. As a physician, I know that we are not only talking about technocrat issues, but about saving people's lives. In this regard, equity in access is imperative. It is a duty that we must all work on together, ensuring comprehensive end-to-end pathways to expedite the process from R&D through access and delivery to scale is critical to achieving equitable access. Ladies and gentlemen, Japan is a major actor in the global health. One of our top priorities is to achieve universal health coverage. As we will chair the G7 next year, we started discussion the agenda actively with multi-stakeholders, including the research institutions and the relevant international organizations. One of the key groups contributing to G7 next year is the G7 Global Health Task Force. The aim of this task force is to make recommendations for reflection and actions to strengthen pandemic prevention, preparedness, and response, and to improve synergies and the contributions of the overall global health system towards improved health, well-being, and the global health security. We sincerely appreciate that Dr. Philippe Duneton, Executive Director of Unitaid, and Mr. Peter Sands, Executive Director of the Global Fund, have accepted to bring their expertise and experience to this task force. To conclude, Japan wishes to encourage continued cooperation and partnership between Unitaid and the Global Fund to accelerate the development and widespread access to innovation in health. I thank you.
Thank you so much, Assistant Minister Hinoshita, for those closing remarks. I would now like to turn it back to my colleague Miriam, who will close us out. Thanks, and over to you.
Thank you, Tenu. And I think all that's left for me to do now is to really thank everyone, all the participants, the speakers, the panelists, for bringing their perspectives, for your questions, and for the rich discussions and testimonials that we had. We all look very much forward to continuing this discussion with you and to be in touch with further updates shortly. Thank you all very much again, and have a good Friday.
Thanks, Miriam.